Great. Well, thank you all so much for joining the California Master Plan for Aging Impact Stakeholder Committee. We'll be here from 1 to 4. And before we get started, I'd like to cover a couple of logistics items. So first of all, we do have American Sign Language interpreting and live closed captioning available. You should see our interpreter Carol on your screen. And if you need to enable subtitles, there is a closed captioning icon on your toolbar. It might say closed captioning, it might say live transcript, but you can turn on subtitles by clicking that icon. The meeting slides, recording, and transcript will be posted to the California Health and Human Services Master Plan for Aging webpage after the event. So if you need access to that, please feel free to check that out. We are saving some time at the end for public comments, so you will be muted for the presentation and discussion among committee members, and we'll open it up at the end to hear from all of you. If you're joining by phone, you will need to press *9, and that will allow you to enter the queue to make a comment. If you are joining us on your computer or via webinar Zoom, you can click the raise hand icon to join the queue, or you can use the Q&A feature. So you'll see a Q&A icon at the bottom of your screen, and you can drop your public comments there at any time. For additional public comment, if we don't have a chance to get to you or you think of things after today's meeting, you can always email engage@aging.ca.gov. And with that, I will pass it off to Richard Figueroa.
Thank you so much for that introduction. I just wanted to say a quick hello from the governor's office. I'm Richard Figueroa. I'm a deputy cabinet secretary in the office of Governor Gavin Newsom, where I work on health and human services issues. I know, the members of the impact group, but for all this more generally, I just want to thank you very much for agreeing to advise the state on a successful implementation. You folks have unparalleled experience, expertise, and networks that we hope to bring to bear and to tap in this effort. As you know, this marks a new stage for the Master Plan for Aging. We're no longer planning, we're now in the doing part, but it also represents a continuation of deep engagement and partnership with you, our stakeholders, in making this successful. The Master Plan is rolling out at an historic moment for state and for older adults. While we are still recovering from COVID, and certainly dealing with kind of the continued efforts we need to kind of finish beating down this virus. We also have seen unprecedented federal and state investments, building back better, to be a true Californian for all ages. So just a kind of little recap from my perspective, beginning from the January budget launch, the Master Plan for Aging has been backed by real commitment and proposed investments from the governor. In January, despite what we knew at the time was a very uncertain financial picture, the governor proposed several $100 million in targeted investments for a variety of initiatives targeted at older Californians, with some additional specific references to programs targeted at persons and families with Alzheimer's. The budget also made reference to further proposals to come in the spring. Well, as you know, our fiscal picture brightened substantially by spring, and it's part of what we call the May revision, which is a revision to the January budget based on the most recent financial projections we have. And because of a brightened fiscal picture in terms of federal investments in states coming out of COVID, and with the sage advice of Director Kim McCoy-Wade, and of course Secretary Galley, and the governor, we were able to propose hundreds of millions more in targeted investments. Then the final budget, which has been signed over the budget bills have been signed over the last few days here, included not hundreds of millions, but literally billions of dollars in additional commitments to services for older persons and the disabled, including the late-breaking home and community-based services proposal, which was submitted just yesterday to the federal government that came out of ARPA, which is designation of one of the federal post-COVID bills. So items such as the Medicaid expansion to persons 50 and older, regardless of immigration status, eventual elimination of the Medi-Cal asset test, additional dollars for senior nutrition, senior technology, an SSP, COLA, hundreds of millions in training funds for IHSS and other care workers, and on and on. So, needless to say, this wouldn't have happened without a roadmap. And so again, as I said before, the timing of the master plan for aging couldn't have been better. Also, needless to say, the proof is in the pudding. And we will need your advice and counsel on the implementation of these activities to make them truly successful. For those of you that have been around a while, the scope of what we proposed and was eventually adopted this year is just simply breathtaking in its scope, and really does pave a way, not just for now, but for the next several years of further implementation of so many of the things that we hoped would come to pass as a result of the master plan for aging. So thank you again for participating up to this point, which of course was, literally hundreds, if not thousands of hours of work into the planning process, and now assisting us in the process of making it a reality on the ground for older Californians and persons with disabilities. So again, thank you for agreeing to participate and continue along this path with us. And I'll turn it over to Director Kim McCoy-Wade.
Thank you so much, Fig, for the warm welcome and marking this moment, 6-month anniversary of launch, and really the beginning of a new stage. We've been racing to launch, and now we really need more than ever this group's advice and oversight and recommendations to stay the course, correct the course, and make sure we hit our mark. I want to start by doing introductions. Quite simply, we've got 9 people who, despite the tens of thousands of hours that have already been put towards building an age and disability and dementia-friendly state, signed up for more. And we really welcome you. You were chosen because of your tremendous expertise, your experience, your networks that you communicate with and learn from and share out with, and your commitment to collaboration and to equity, among other shared values. So I'd like to take a moment for each of you to introduce yourself, and feel free to say a few minutes about what brings you and the organization to impact. And we will do it by the slides. Susan.
Great. Good afternoon, everyone. I'm Susan DeMorris, and I'm representing the Alzheimer's Association in California. We have 5 chapters throughout the state, and we're part of a national organization headquartered in Chicago with a big footprint in Washington, D.C. And it's an absolute honor and privilege to serve on the Impact Committee. Something that I intend to bring to this distinguished body is if you look at Alzheimer's disease in California, family caregivers range in age from teenagers to people over 100. People who are at risk of Alzheimer's and dementia are in their 30s, 40s, and 50s. And people living with Alzheimer's disease run the gamut from their 40s into well into their, well beyond 100 years old. So it's an honor to be part of this group where we can look holistically and comprehensively at our state's systems and structures, so that we put the person at the center of our work going forward. So whether somebody's living at home independently, living at home with some assistance, living in long-term care where more than half of all residents have Alzheimer's or dementia, or in our hospital and health systems, that cuts across everyone in California who lives with Alzheimer's, dementia, or is a family caregiver. So I'll be taking the big picture view, and it's just really a privilege to be part of this. Thank you for the honor.
Andy.
Yes, hi, thank you, Kim, and hi to everyone. I'm Andy Imperato. I'm the Executive Director at Disability Rights California. Like Susan, I had the honor of serving on the Stakeholder Advisory Committee for the Master Plan for Aging, something that I inherited from my predecessor at Disability Rights California, Catherine Blakemore. So I kind of came in midstream, and it's just been a pleasure working with Kim, working with Kevin Pernival, Susan, Fernando Torres-Gil, all the folks on the Stakeholder Advisory Committee. my background, I'm a disability policy wonk. I have lived experience with bipolar disorder. I did this work in DC for 26 years before coming back to my home state last year, including working for Senator Tom Harkin on the US Senate Committee on Health, Education, Labor, and Pensions. And I think, one of the themes of our master plan work has been that you really can't do disability policy without thinking about aging, and you can't do aging policy without thinking about disability. So I'm grateful that with the Impact Committee, we're going to continue to have a strong theme around that. I appreciate Fig calling out some of the investments, not just around aging, but also around people with disabilities. And my goal in this stage of my career back in California is for California to be the best state in the country for people with disabilities and for people as they get older. And I feel like the changes that are happening in the state, the budget things that Fig laid out, it really feels like we can do that. We're not there yet. It's a big state. We have a lot of challenges. But I'm excited about the possibilities for the future, and I really appreciate the leadership of Governor Newsom, Secretary Galley, and all the folks that have worked across the cabinet on the master plan. And when Kim asked me to do this, I said yes, because I'm happy to continue working with Kim, who I think is an extraordinary leader. So thank you.
Thank you, Andy. Nancy McPherson.
Hi, everyone. I'm so delighted to be here to represent AARP and older adults who are 50 plus and their families in California. I do want to thank Nina Weiler-Harwell, who was our representative to the Stakeholder Advisory Group, for being involved in the planning, because we have been involved in both the advocating for the master plan, like so many of my colleagues, on impact, as well as planning with, and now really enthusiastically looking forward to supporting the implementation of the plan. In California, AARP's overarching frame for all of our work is creating livable communities that people can live in throughout their lifetime, and that they can make choices about how they age. And we think the master plan really offers an opportunity to do that. Our 4 major areas under our livable communities framework are caregiving, financial security, age-friendly communities, and technology, both technology infrastructure and technology access. So we look forward to participating, to supporting, to giving honest, candid feedback, and to working closely with our colleagues who are part of this. Thank you.
Great, thank you. Good afternoon, everyone. I'm Sarita Mohanty, and I am privileged and honored to be part of this Impact Committee. I represent the SCAN Foundation as its president and CEO. I have been with the SCAN Foundation for a little over 6 months now, and it has really been an honor to really work with the leadership of that is supporting the master plan for aging, and really have been so impressed with the planning that has gone on, even preceding my joining the SCAN Foundation, with the master plan itself. And as Kim mentioned, this is really an opportunity, and Richard Figueroa mentioned, this is a time for really about doing and moving from the planning. And so that particularly excites me. Just a little background about the SCAN Foundation. We are a public charity focused on improving and transforming the lives of adults in California and throughout the country, supporting programs and policies. I am particularly excited because we are really focused on person-centeredness. And I have seen firsthand how older adults struggle to access services they need across systems of care. As a physician and having worked with health plans, many are left with nowhere to turn, without options, and with no one to really help them through these struggles. So the opportunity to work with a vulnerable population, older adults, to on seamless coordinated services for older adults is a particular passion for me and for the SCAN Foundation, and I imagine for all of you, which so I am excited to work with esteemed members of this committee to especially given what we've learned with the pandemic and the crises that left us understanding the grave inequities in access to quality health, which in our minds really encompasses the physical, the social, the behavioral aspects of care. So with that, I am really truly excited and ready to roll up our sleeves and get going. So thank you.
Thank you. I'd like to hand it to Doug Moore.
Good afternoon, everyone. I'm Doug Moore, the Executive Director of UDW, United Domestic Workers. It's a labor union that represents home care providers and child care providers. We represent about 120 home care providers through the in-home support services program. And it's a privilege to be the Executive Director of this organization. You see firsthand of what caregivers do. They are just that, they are givers. They are not takers, they are givers of their time, their life. And you also get to experience, it's not a good experience, but you end up seeing your members become the client because they spend so much time taking care of that loved one that many times they become the client. I've seen it happen several times. In fact, it happened with my dad. And to be able to be part of this organization, to really look at what needs to be done for Alzheimer's patients, the elderly, disabled, this is a big opportunity to actually implement something versus just putting it on paper. And we have a commitment to making long-term care accessible to everyone. I think it's necessary. The time has come. Thank you.
Thank you. And I want to acknowledge that both Doug Moore and Susan Damaris, in addition to their organization's Master Plan for Aging Service, were on the governor's Alzheimer's Advisory Preparedness, Planning, and 3Ps task force chaired by Maria Shriver. So it's wonderful to again have this alignment with Alzheimer's and aging. So for our next slide, Sharon Nevins will be the appointed member. She is, I'm going to take a second here. She is finishing up a leave, so her deputy will be representing her today. But for those of you who don't know Sharon, she is the director of San Bernardino County Department of Aging and Adult Services, which is also the Area Agency on Aging for that county, and a member of the National C4A Board, Area Agency on Aging Board, excuse me, and the California Board. But Glenda, as the conservator, guardian, and the chief deputy for San Bernardino, welcome.
Welcome and thank you. And on behalf of Sharon, it is an honor to be part of the Impact Committee, as collectively we work together to address and to be change agent for our senior population through partnerships and collaboration. Look forward to bringing forth some new ideas and experience to continue that process. Thank you.
Thank you. Kevin. You're muted.
We can't hear you, Kevin.
Okay, is that better, I hope?
Yeah.
All right. Well, hey, everybody, I'm Kevin Pernival. I'm the Executive Director of Justice and Aging. I'll echo everyone else's comments that it's a real honor to be serving on this committee and working with a broad array of stakeholders outside of this committee to really advance these issues. At Justice and Aging, we're a national nonprofit organization that uses the power of law to fight senior poverty. And everything we do is really focused on low-income older adults and addressing issues of poverty, economic security, and equity as well. And so I'm looking forward to bringing that into the room. We're a national organization, but we do a lot of work in California because California is a really important state in a variety of ways. It's been an honor to be part of the Master Plan for Aging process. I think we've developed really wonderful ways of working together as a community of aging advocates and service providers, as well as incorporating and really partnering with Andy and the whole disability community. And I'm looking forward to continuing that work and really appreciative of the tremendous leadership from Kim, from Fig, from the governor, from leaders in the legislature. Really feels like we've got a lot of momentum right now and a lot of cohesion about the direction that we're heading. And like Fig said, now some real investments to make this go. So I'm excited for the Impact Committee, for all of us to be representing the different constituencies we work with and to bring those voices and perspectives into this level of the work, and just appreciative of all of you for being here.
Karen.
Great, thanks, Kim. And thanks so much for the invitation to this table. My name is Karen Savage-Sunwan. I'm the Executive Director of the California Pan-Ethnic Health Network. We are a statewide multicultural health advocacy organization. We work across the state of California with a network of grassroots community-based organizations who are all deeply embedded in communities of color and working to advance racial equity and health equity. And I think really honored to be a part of this committee and really hope to bring to this committee a strong racial equity lens, because what we know is that people of color live in less healthy communities, have less access to health care, have poorer health outcomes, and ultimately have shorter life expectancies. And so we believe that all of the policy and resource allocation decisions that we make in this state really need to be made, I think, with a firm commitment to racial justice and racial equity. So really hope to bring that to this table, and really looking for intersections and opportunities, and also leaning in, I think, to thinking about how do we really build a strong community infrastructure that will be there to serve all of us, and particularly to serve our aging population. So thank you again for the invitation.
And Professor Torres-Gill.
Hello, folks. Thank you for this. Again, like everyone else, it's so exciting to be part of this impact group, to continue the amazing work from the Stakeholder Advisory Committee. And like all of us, we are just thrilled about this amazing window of opportunity, not just with the full support from the governor, the legislature, and all the amazing participants and stakeholders on our advisory group that led up to the Master Plan on Aging, but also about this tremendous infusion of resources, real investments. And I cannot, in my long lifespan in California, I cannot think of a time when we had this kind of coming together synergy between the executive, the legislative, the stakeholders, the advocates, the groups involved in these issues, all coming together, taking advantage of this tremendous fiscal support to move forward on the implementation. So I am certainly looking forward to working with this group and everyone else. I happen to be on the faculty at UCLA and USC. I'm a truant, I'm proud to say. But I'm also very interested in issues of aging and disability and ethnicity. As a polio survivor, aging with a disability, reaching 73 great years of age, I will certainly support Andy and all the disability rights group. But I'm also both pleased with our Master Plan on Aging, and will work to ensure that two of the key concepts that came out, which I think are important to implementation, is the equity lens and intergenerational. And certainly we're all well aware that California is one of the most diverse states in the country. We're also well aware of the tremendous economic disparities related to race, ethnicity, immigration status. And I think we're all well aware that not only are we advocating for older adults and increasingly diverse older adults, but especially younger communities of color, AAPI, Latino, Latinx, African Americans, Native Americans, undocumented persons, because we want to ensure they too enjoy a healthy, long life and enjoy all the great things we're trying to do for older adults. And so we hopefully will keep in mind as we implement many of the findings that it's also about an intergenerational, interethnic, interracial approach, and showing the rest of the country that the country can look forward to a majority minority state that's living long and where all ages are contributing to our prosperity. So anyways, I'm looking forward to doing my part to ensure the implementation occurs, and to working with the entire state government. And as a board member of Justice and Aging. I look forward certainly to working closely with Kevin and everyone else. So thank you very much. And I think we're all getting ready to work.
Perfect introduction. Thank you all. Let me just briefly introduce the other boxes that you're seeing. The Master Plan for Aging team I want to acknowledge Amanda Lawrence and Terry Shaw, who you'll be hearing from later, and our terrific communications team, sign language interpretation team, and captions team, all of whom have made today possible. So thank you to everyone for being here. I do want to also encourage you, you may have noticed, and we'll talk about this in a second, we have a smaller group for the impact group so that we can have more discussion and more conversation. So in service of that, there will be very few slides. I'll give you the agenda so that you can see where we're going to go, but we're going to try to take slides down. I personally have my Zoom set on gallery so I can see the 9 faces of our impact stakeholder members and our interpreter so that we can have as much as we can replicate that connection and that dialogue. And we had tried to create a lot of space for discussion. So this was the agenda is our attempt for times. My commitment will be that we will get to all of these things on the agenda, but we can stretch and shrink as the discussion takes us. So what we'd like to do today, if you look at the agenda, is spend a few minutes about the purpose. Again, it's different. We're in the doing. What is the role of this group? I want to plant some seeds there, but not finish the conversation, start the conversation. Because what I would like to then do is kind of go through the work. Spend some time with our first progress report just came out this morning. Thank you for your patience as every time we tried to put it to bed, something else happened. So it's a good problem to have. But I assure you, we're not going to do a line-by-line reading of a 10-page document. We're not going to do 100 slides. We're really going to try to do highlights so that we can get to that discussion. And then we'll have public comment. We want to make sure there's public comment throughout the meeting. And then, as many folks have advised, everyone needs a break in the middle of a 3-hour meeting. Of course, we're all adults, so step away as you need, but we will stop and give the whole team a break around the midpoint. Then we'll come back and talk about 2 other areas of accountability. One, we are really committed to empowering and supporting local leaders and local plans for aging. And so we'll give you an update on that and discuss what the role could be there. And then data-driven. We're very pleased to talk about the data dashboard for aging, where it is and how it can be useful to you in measuring our progress and continually improving. Then I want to come back to this operational and we can talk about, well, how do we want to meet? We have some ideas, but I think it will be helpful to kind of tee up the how we want to work, talk about the work, and then come back to how we want to work at the end. And we'll see how far we get if we can land it today, but we've got a straw proposal. But again, as those of you who were with us in Master Plan know, we like to co-create. So very eager to hear your proposals too for how this group can be most effective. And again, public comment, and then we'll be sure we leave with clear next steps. Okay, keep going. Seeing nods. So the purpose of the Impact Stakeholder Committee, and we have drafted a charter that was sent to you and we asked you to consider serving, and it is being added to the agency CHSS page. I'm not sure if our team can put those links in the Q&A. So people who want to go to the documents at the California Health and Human Services agency page, Master Plan for Aging, to find the agenda, the progress report, and the charter posted soon. This is really, I keep coming back to advice and accountability. These are what we're looking for in both the short, medium, and long term. So there's accountability for doing what we said we would do, but there's also the oversight and advice on, are we moving the needle? Or as Gretchen Malcolm from SCAN Foundation sometimes says, are the drivers driving towards the outcomes? Kieran mentioned life expectancy. Others of you mentioned equity. Doug mentioned, good jobs. Like, are those outcome measures moving? And those are going to be challenging to measure on a quarter by quarter or year by year basis. But we want to really make sure that we are making progress, that we're addressing gaps, that we're addressing missteps, and that we're responding to new opportunities such as have been coming with home and community-based services and federal funding and the California Comeback Plan. And, again, responding to, dare I say, threats like such as the pandemic and other serious challenges. The other thing that we want to make sure we get advice on is this first 2 years. We tried this process of 150 initiatives and executing those in 2 years. This group will be thinking about, do we do that again for the next 2 years, or is a different way of propelling the work forward needed, or an improvement? And there's other questions also about this group. We have intentionally kept small so that we could be more of a working, more like a board of directors, if you will. But we are knowing that the work of the master plan is happening at committees and work groups and departments and agencies and advocates and foundations and employers all over the state. So for example, long before the master plan, of course, CalAIM, the Medicaid reimagining is being led by DHCS. Our in-home supportive services work, long history of leadership by CDSS and partnership, that all continues. What the master plan has been able to accelerate is some new cross-department groups, and we'll talk about that in a second. Person-centered, whether it's the Community Living Advisory Committee, some re-energy for the Alzheimer's Task Force. So we want those groups to lead that work. Those are where the experts are, the departments are, the agencies are. You all have the interesting challenge and opportunity to be informed by all of that and bring it to the table and kind of have that overarching view as a state, as a sector, person-centered, population-centered, how are we doing? But we know that the work, the substantive work on those 100 initiatives, those 23 strategies is happening at the proper table. So let me stop. I kind of want to just outline some of those pieces. We do have a thought that a quarterly meeting would be about right for this, because in 2 years, especially starting now, that's about 6 more meetings. It goes quick. We also have some thoughts about developing the agenda with a small group of you each time. We could think about one possibility is at each meeting, we do a deep focus on one of the 5 goals and bring the right cabinet members and advocates and other partners to the table. We don't have to be constrained by that, but there's a couple ways we want to make sure that we are bringing in the experts and the information that you want to hear about to the meeting. So that's about as far as we got in terms of, and I guess the other question is how you all give your accountability to us. Do you want to think about doing a stakeholder report, dare I say, those of you who are still, had written many in 19 and 20 and 21, a stakeholder report either periodically at the end of the 2 years? Is that something that is a process that you all would want to organize from the community or not? There's many ways for this to work. So I think just posing those questions about, so some of those higher level about the vision for the committee, but then those practical questions about frequency, agenda development, and delivery of your recommendations or your input in any kind of structured way beyond the discussions we have at this table. Those are all open questions for us. So let me stop there and see if we can have that part of the discussion. I guess I should also acknowledge we have had some questions about the size of the task force, and some of the master plan SAC members have suggested an addition of another member, and so that's under consideration as well. But let me stop there and hear from you all some initial thoughts about how the committee can work, and then we'll come back after we've presented some of the work.
I'll jump in. So one thought that I'm having in my own work is, and it's a wonderful dilemma, and we have the governor, the administration, and the legislature to thank, that we're building and implementing at the same time. And this coming year, we'll have more to implement than we've ever had before. So I really like the idea, Kim, of focusing on a goal area more in depth, so that not the right people, but that the people with jurisdiction and expertise on a given topic can be at the table. I think those conversations will be more fruitful. And I realize in saying that it may require 5 meetings a year to do that. And I'd be willing to do that if we met bi-monthly. So I do like that idea. Instead of a broad brush and a light touch, each meeting might not be as satisfying.
Nancy, I know you had some thoughtful questions about process and purpose. Would you like to share some of those with the group?
Yeah, those weren't just my questions. I kind of captured them from the group discussion we had yesterday, so invite others to jump in as well. I do think having some group guidelines to kind of help us figure out how we work together and how we treat each other in the meeting. It's always a good thing to do that at the beginning. Just particularly because I hope we don't agree on everything. And so, you know, what's our framework for not agreeing with each other and then moving forward on things? Because I think we want to invite respectful conflict into the process so we get at the best outcomes. And I would also, I support what Susan was saying about focusing on the big goals, Kim, which you posited. I think that would be really helpful. I also would like to invite the state to help us figure out a way to talk about things that aren't working. That's always hard to do in a public meeting, but I think it's really an important thing for us to be able to deliberate on, particularly so we can provide appropriate advocacy for things to work better. So if there's a mechanism for doing that, I think it would be helpful.
And I'm now seeing the raised hands queue. Apologize if I was slow to see that, but Fernando.
I think Andy was first.
Okay.
I'm always happy to defer to Fernando, but Kim, the one thing I want to say, and I know you have experience doing work at the federal level and at the state level, but one of the things that sometimes happens in these cross-cutting initiatives is each agency kind of owns their piece, and you don't always get the cross-pollination. And I guess an example of that for me would be the approach that we take to housing and trying to improve the housing situation. I think there might be a tendency to leave it to the state agency that owns housing to do it, but obviously there's a lot of money and capacity in health and human services. So if there's a way to design that strategy where those two agencies are kind of locked at the hip, I think it's going to produce bigger ideas that are going to work better. So I just put that out there. Anything we can do to try to keep multiple cabinet agencies at the table, to me, would be very valuable.
Fernando?
Oh, yes, and I'm still trying to get a handle on kind of exactly what will be our charge in a more pragmatic way. My sense is that we're going to be kind of the oversight accountability group to monitor and ensure that the many recommendations from the master plan move forward. But one question within that, how is it that we connect with, certainly with Dr. Gailey and with the governor's office? And as part of that, how does that relate to if and when there might be a special counselor, advisor in the governor's office? I mean, what are the relationships and with this impact group?
That was both a comment and a question, so I'm pausing. Yes, I think that's right. The clarity on how to do oversight. And I guess, you know, my 2 cents would be part of it is did the work get done? But I think the higher level oversight, the strategic oversight on are we moving the needle? Are we achieving the goals? And to Nancy's point, I'm sorry, I'm taking notes and listening. The person, I think Nancy said things that aren't working, how we create that safe space for, gosh, we're not making the progress. And, you know, just in the spirit of that, I think many people were disappointed in the transportation recommendations in the master plan for aging. So is that an area where we can go deeper? Behavioral health has recently been surfaced to me. So I think that's right. How do we create? So I think that's all kind of, at a minimum, I think we can have good discussions. I think the question is, are there written recommendations? Are there reports? You know, the timing of that, I think we need to figure out. Fig, I don't know if you wanna, Fig was just here. Yeah, Fig, if you want to comment on the governor's office position that, as people know, was proposed in the budget in January, was funded in the budget. The new state year is now 2 weeks underway. So that's certainly moving ahead. But Fig, I don't know if you want to speak to that more directly as a process piece.
Yeah, I mean, I think, the legislature did approve it, and so we're going to be going down the path of making that add. The way that all special advisors work in the governor's office, and we have several. We have one on early childhood ed. We have one on immigration. We have several that do different kinds of things. They're all attached to the governor's office cabinet unit, of which I am also a member. And so we all, even though it kind of crosses the areas, we kind of all work together to define issues, to work on those issues. So I would think that the special advisor will certainly be monitoring what is happening, with the impact group here, as well as the other kinds of advisory groups that are happening in the Health and Human Services area related to aging, disability, and Alzheimer's, and providing that additional input in a more focused way than even I'm able to do, because I have a much broader span that includes, permanent healthcare services, social services, just a very wide variety of things. And so having a special advisor really allows us to hone in and get in much more detail on the specific areas that are the responsibility of that advisor. And I would be expecting they'd be weighing in on things like the budget and ongoing policy kind of thing. They'd obviously be working very closely with me, obviously as well, because I still have Health and Human Services Agency in my world. So I think some of this is going to kind of evolve over time. I think, as all of you know, there are many different advisory committees, commissions, committees, work groups in the aging and disability and Alzheimer's space. But again, it's going to give a special, an opportunity to really specifically hone in on those issues and advise not only the governor's office, but all the different cabinet secretaries, because this is a very cross-cutting, especially the master plan for aging is a very, very cross-cutting kind of approach. So I don't have all the answers yet. This is going to evolve over time, I think, a little bit, but as there's no, we first have to get the person in there to help define the position. So that's what we're working on now. I don't have a name for you. I don't have a name and a date for you right at this second. We're just trying to get the bill signed and get the announcement out, which was yesterday generally. So now, like many of you, now it's the doing part. We did the proposing, now we have to do the doing part too. So that's on me. So I appreciate the question.
Let's do Sarita and Kevin, and then maybe we can take this in and pivot to the next topic. But Sarita.
Yeah, thank you. No, I just want to reiterate, I think some of the things I agree with the concept idea, going back to Susan's comment about focusing on a goal area. I think it's a good concept. I do think it is important to leave some time during these committee sessions to address kind of, I think Nancy mentioned, some of the issues, maybe risks, as much as we can, to understand what pivots based on current issues are going to be happening and that we need to consider for the master plan. So, looking at current events, those type of things, having a little bit of time to focus on those during the agendas. I think the other thing that would be great is, there was comment about the different committees, work groups, and it'd be great to have, as part of the session, meeting to hear from those committees periodically, to, whether it's the equity committee or others. So that's another suggestion that I would bring forth. And then I do also like the idea, I think, Kim, you brought this up, about maybe a report out at the end of the year from the stakeholders themselves, with recommendations, especially given the fact that the master plan will be, kind of being updated each year. So maybe that report would be useful. So those are some thoughts and suggestions.
Kevin.
Yeah, and I agree with a lot of what was said as well. I think, Kim, you're laying out, I think these last 6 months of the master plan, a lot has been about setting up the structures. And now we've got some of the money to start doing these things. And I appreciate that there's many levels of structure. And as you identified, there's these various work groups where the true experts live and where the work is done. And so I don't really see that as our role, but rather our role is to hear about how that's going and to provide that overview. Looking at those measurements, like, okay, we did a bunch of stuff, but have we moved the needle on equity, on, poverty, on access to housing and healthcare? And I don't know that those conversations are going to happen necessarily in those other groups. So that seems like a good conversation for us. And I think, as others have said, it would be wonderful if there's a way, Kim, for you and the state to come to us and say, here's what we're seeing, here's what's working, here's where our challenges are. And then I think it's on us as committee members to be talking to our networks, to both like the networks we serve through our organizations, the coordinating each of us does, with many of us sitting still serving as part of the Stakeholder Advisory Committee and meeting with colleagues. I know I have staff members from Justice and Aging who are on the Equity Work Group and the DAC-LAC, and so kind of collecting that information so we can come and tell you, Kim, and your team, here's what we see that's working, here's what we see that's not working. We want to problem solve together to address these things. So I really like the idea of working together on agenda setting prior to meetings. I'd be happy to be part of that process. I imagine others will as well. So I like that, being able to kind of set committee. And then I think a good question that Nancy has raised when we talked is, what's the process for feedback? When we show up at a meeting, Kim, and we say, you know, hey, this isn't working so well, we don't expect that you'll necessarily be able to tell us what you're going to do about it during our meeting in that moment. But what will happen after the meeting? How will we know we were heard, and what's the iterative process there for engaging with our committee? Or is it engagement with, you know, you need to work more with the equity committee because we're hearing from them that we're not making enough progress there. So, you know, that's where the work then would go, but there's some type of accountability and feedback there.
Okay, this is all incredibly helpful. I mean, I'm again, let's simmer on this the next couple hours as we talk about the content. But I'm hearing some things like, for next steps, yes, a meeting calendar, but more really a meeting template or a meeting approach that includes these elements of maybe a goal focus that has that outcome. You know, poverty, closing the gap in affordability for all, longevity. Making sure it's data driven, but also has the stakeholders, the agency, the departments, but also not being too presentation focused, right? I know that the purpose of having a small group is to really dig in. I do like kind of naming this, where do we continuous improvement section, right? Where do we want to spend time problem solving, using your expertise and your insight to make sure that's what we're using this valuable time together to do, and not just pat ourselves on the back for all the great work that we're doing, although that's important too, but that we really spend the time on moving the big rocks forward. So we can work a little, I think that could be an action step, is kind of the calendar and the structure. And I really do think Nancy's point about the meeting guidelines, and I love one of the phrases, respectful conflict, that sort of norming that and inviting that, planning for that. Is a really helpful frame, and we can welcome people's suggestions. If you've seen kind of, I know AARP, I love your tabletop guidelines. When I used to go to meetings in your space, you had some good examples of that, but we can again work with the group to develop that more clearly, so we're all on the same page when we do get to those good tough discussions. Can we sit with that kind of as possible for a couple hours and see if that's still how we want to add to that when we after we talk about the work? Okay. Then let me give you the shortest and fastest update on a lot of work. We're going to show you a couple slides. And again, because we do have, this is a public meeting with 100 folks with us, we want to kind of do a quick how we got here. Very quickly, think back to before COVID, think back to the first year of the new administration. June 2019, the governor saw that aging is changing and changing California, and that critical to a California for all would be a master plan for aging with stakeholders, with the full cabinet, laser focused on research and on long-term care. And so that's how we launched in June. And by the fall of 2019, we were working with our stakeholder committee, which many of you were on, and the research and the long-term services and supports, and soon added an equity committee, thanks to the strong recommendations of the stakeholders. Have to acknowledge by spring, sorry, back on that slide 1 second, by spring of 20, of course, the pandemic hit with devastating impacts for our communities, challenges to our service network, challenges to us personally. But in the end, it made the work more urgent and more relevant. And so we soldiered on, and by January 21, we launched just 6 months ago. Next slide. So as Kevin kind of well summed up, we're, I mean, really we're a quarter through our first 2-year cycle. It's kind of amazing. We really have been focused on a lot of structures. And so you'll hear some of the updates that I'm going to give you very briefly are structure focused, creating those cross-department tables, like Andy said. I'll be happy to give you an update on that housing table that brings together cross-agency and cross-department. But we're very pleased that today is both the 6-month progress report came out and this group is meeting. And that 2 weeks ago, the cabinet work group met. So we had kind of our 6-month anniversary gatherings. And we just want to acknowledge that the progress report, in order to get it out for this meeting, we did not include budget updates. So there will be a master plan for aging budget update in coming weeks as all the dust settles. We did that in January with the governor's proposals across all 5 goals in May. And then it's just been a whirlwind, as you know, of opportunity the last 2 months. And so as that all comes out, we will later this summer have a master plan budget document to as a companion to the progress report. And then we're thinking we'll do an annual report in January, but we want to make sure that those are useful and add value. And so again, another place we're open to oversight. We just don't want to drift. So we want to kind of put those markers for ourselves, but also want to make sure they add value. Next slide. So here we are. What can I tell you about the first 6 months? I do commend the 10-page report to you that's on the agency website today. Next slide. I'm just going to give some very high-level updates and buckets. I have to say I was very grateful to the community for rallying for the launch in January, right before budget season, right before bill season, a very tense time in our community, our country politically. But nonetheless, we had cabinet secretaries, legislators, stakeholders all there for the launch and the summit. And it just really, the launch itself, I thought, embodied our partnership and our collaboration and perseverance. Partnership has really been the theme of the last 6 months. And I guess that's not a new theme for the master plan, but I just want to lift up a few before I talk about the intergovernment coordination. Obviously, we are thrilled that California has become the 8th state to join the AARP age-friendly national and, dare I say, global network. It's long been in progress. So that is a key partnership with AARP, who, of course, I always get the number wrong, Nancy, but something like 50 California cities, probably more, already in that network. So we are standing on the shoulders of our local communities and hoping to bring more with us. Another major partnership is that Sarita is well aware of is the Philanthropy. We continue to have foundations say, how can we help? How can we help now that you're doing? And we have been thrilled to be a bit of a broker, an air traffic control and matchmaker in trying to help Philanthropy connect with aging initiatives. And tomorrow, the governor's office is co-sponsoring with Philanthropy California a briefing on intersections with aging, health, human services, equity, all intersections with aging for a range of philanthropic partners, where we're inviting them both to join us in an ongoing table to just talk about philanthropic intersections, and also have lifted up about 15 different potential funding opportunities that our cabinet recommended as places where philanthropic dollars could be helpful as conversation starting points. So we wouldn't be here without the Philanthropy's catalytic investments, and the opportunity to really be strategic in addition to the public investments is huge. Another partnership that I want to, Terry Shaw will talk more about if there's questions, but is critical with our research committee. We need to leverage the enormous power of both USC and UCLA, as Fernando wisely said, all of our academic institutions that have so much expertise to bring. And in particular, I'm narrowly focused on the outcomes report. You know, at CDA, we can tell you if we did the work, but we need that research powerhouse to tell you if it made a difference. And so working with them to how would we think about an outcomes report? How would we think about data access is something that they have been working very closely with Terry to kind of strengthen that, even as the state budget has proposed the creation of a policy and data shop at the Department of Aging, which we're very pleased to begin standing up. And then the last partnership, Amanda will talk more about, but the number of local groups and network of local groups who have asked for local playbook trainings, I think surprised even us. So Amanda has been doing a virtual roadshow that she will talk about, but I think the potential to support and connect local leaders is something we'd love to get your expertise and advice on. And again, many of you are doing this daily with your local network. So I want to make sure we're being the best resource we can, so that, as I always say, I think there's 3 master plans for aging right now, depending on how you count, in Los Angeles, San Diego, and San Francisco. We'd love it to be statewide. And again, we don't care if it's the AARP age-friendly or our master plan, but we want strategic collaborative plans for aging across the state. So in addition to partnership, I want to kind of give you a brief update about the work we're doing to advance the goals cross-cabinet, cross-department. And I'm just going to give you, I think I'll do 3 examples. One you well know is the Community Living Advisory Committee that is the product of multiple departments in Health and Human Services, as well as housing, transportation, and labor. I hope people can see that group was built on the tremendous legacy of Olmsted and is really meant to power us to the future. And in particular, the new Home and Community-Based Services spending plan is a really cross-department effort that we think community living can be a terrific stakeholder in helping advise that home and community-based services cross-sector work. So we'll be working more with Eric Harris from DRC and Claire Ramsey from Justice and Aging about our next meeting in August, but really thinking that the home and community-based service, again, person-centered, system-focused, could be a good partnership there. And it's been terrific for our departments to work that way. And I should mention, one piece of that is a series of workforce investments in the direct care sector, direct care IHSS, direct care non-IHSS, home health, CNA, and again, the departments convened together this week with our partners at Labor Workforce to begin talking about how we set that direct care solutions workforce table with our stakeholders to really have a sector strategy for good jobs, for good care. This was partly the vision of former Secretary Julie Su, now National, I believe, I don't know if she's sworn in yet, but confirmed Deputy Labor Secretary Julie Su to co-lead this with Secretary Galley. And we're really looking forward to implementing her vision of how we build that good jobs piece across department, cross sector. 2 others, elder justice. We've had our first meeting with Department of Justice, Social Services, and ourselves convened. Gosh, 15 departments have a role. We're up to 15. And we're not even sure we have them all in abuse and neglect and fraud and exploitation across all settings. We had our first meeting to talk about what we all did, and we got about halfway through. So we're doing a part 2 of all the work that's happening. So we're very excited to begin mapping and coordinating. I want to thank Justice and Aging and the Elder Justice Coalition and CWDA, who all attended that meeting to present some recommendations and some perspectives. And we're looking forward to setting a table with stakeholders, a true Elder Justice Coordinating Council later this summer, this fall. But I have to say the work to map what we do already, and particularly what the local leadership does, is deeper than we thought, and I think hopefully richer. And then housing, I would be remiss if I didn't finish with housing. Housing, we have been very fortunate that we went to Philanthropy and asked for some help to map the continuum of housing options from a person-centered view as we age and experience disability. Everything from staying in a private home where you might need a home care worker or a home modification, to moving to a ADU with a family member or a worker in a unit, to living in a senior affordable housing, unlicensed, but a communal setting, to licensed assisted living, to licensed skilled nursing. Can we draw that continuum as a state? Do we know our goals? Do we know how we're doing? Do we know where our funding is? We couldn't answer that question. So we asked Philanthropy to help us find a consultant to spend 90 days trying to map that out. And again, we had our last kickoff meeting last week with Housing Agency, Strategic Growth Council, Social Services, Healthcare Services, Department of Developmental Services, all of us with housing intersections to try to understand what are we building towards. So I'll just stop there. There's almost, Susan probably is aware, the same thing is happening with Alzheimer's. Department of Public Health just convened all the departments who have a piece of the Alzheimer's puzzle to pull us together to start to move the Alzheimer's bold goals together and forward in a strategic way. And we're thrilled that Maria Schreiber is convening us tomorrow for an update to her and a reunion on how we're doing on the Alzheimer's. But that is really, Kevin is right, that the last 6 months have really been about how do we map and organize, and then frankly, resource, get the staffing or the philanthropy or the consultants in place to move the work forward. Let me stop there before taking a breath and turning to any budget or policy that we all want to lift up. I'm sure we can all add to that update in a second. But let me just stop on kind of those partnerships and on those internal cross-cabinet organizing and stakeholder organizing. Questions, comments, or things that you are aware of that you want to lift up, all welcome.
So Kim, this is Nancy. I raised my hand, but I'm not sure you can see it. Can you hear me?
I can. Thank you for the prompt.
So one of the things that you mentioned that I think would be really helpful, you mentioned a number of meetings that are going to be taking place with Philanthropy, with a group interested in developing a housing continuum, all of those things. Is it possible to get a list of those, like a calendar of meetings coming up, so we could listen and participate wherever it seems appropriate?
Yes, we can figure out how to better promote what's public and what's open. And yes, that's a great suggestion.
Thank you.
Kim, are you calling on people or do you want us to just chime in?
Sorry, I am. I was, yes, Andy, please.
Yeah, Andy with Disability Rights California. I guess, you know, I'm on this federal COVID-19 health equity task force. And I guess one thing I just want us to think about is we started this process, as you acknowledged, before the pandemic. And then we had the pandemic and a lot of people died. A lot of people with disabilities and older Californians died. We learned things about the inherent risks associated with congregate settings. So I feel like there's like a COVID lesson overlay that I don't want to just gloss over that and kind of get into all these different goals without thinking hard about how have we been changed by this pandemic. And as we think about all the 5 big goals, is there a big tweak that needs to happen from the lessons we learned from the pandemic?
Kevin.
Well, I'll echo that. I think that's really smart, Andy. And I think goes to another point that Andy's talked about, and maybe you'll raise later, Andy, which is, you know, our continued need as we're looking at progress on particular goals, our continued need to share the story, to make the case, to explain why this is important work. We did a lot of that last year, but those of us that work in these spaces know it's a story we have to continue to tell, so that we continue to build support for all the work on the master plan. And I think COVID's an important part of that story, what we've learned, what we're learning, and how we respond. I think that you gave a nice overview, Kim, of a lot of work that's happening. And I really commend the creation of committees in specific areas. So that's helped, I know, me and our team like really focus on where to bring issues and understand what the pace of progress can be. There's a couple spaces where that isn't as clear, I think, to the community from what we've heard. Housing is one. You mentioned that there's some interagency work happening, and I know there's been some engagement from stakeholders, but there's not a real formal process on the housing piece for how stakeholders are engaging and seeing work of agency. So I can see that as an important place. You mentioned this earlier too. We've heard this about transportation as well, that there's not real clarity about how we move forward transportation. 2 other areas where this has come up is climate change came out as an important part of our process as we lived through the fires last summer and the power shutoffs and realizing the impact on older people and people with disabilities. So, where is that moving? And then finally, in that goal 5, all of the stuff around affording aging, where's like a table or a space for that where we can see, like, know where to go do work and partner and make progress on those initiatives. And then I think, I guess another one would be on workforce. And I heard you mention that there is work underway now around bringing together a table, but how is that table going to be defined? And can that be a place where, especially with all these new initiatives that were in the HCBS spending plan, there's like some real opportunity there. And so, is there going to be a dedicated space for moving that work forward, understanding it, kind of giving feedback on how that's moving towards objectives? So those are a few places where I think a little bit more structure would give people more clarity about where to plug in.
Nancy.
Thank you. My second question has to do with how we get a handle on what's happening in the regions and with the local jurisdictions, because that really is going to drive some significant change. because just sometimes of the competition between jurisdictions to do really good work. And so you mentioned that, Kim, not concretely, but in terms of, the importance of bringing that to the table. How can this group actually get a handle on that as well?
Yeah. Yeah. Yeah, I mean, I think in terms of the various bodies, I think that's right, Kevin. We're kind of taking them one at a time, and the ones that were called out in the Master Plan for Aging as specific initiatives came first. So refreshing Olmsted and the LTSS, getting an Elder Justice Coordinating Council, getting a Direct Care Solutions Workforce. Those were all named in the initiatives that Cabinet wanted to do, and so we moved on those. And you're right, we've got a little ad hoc thing happening on housing. That is it ready to mature? I don't think we've thought through how climate or affording could happen. And I'll just be super candid. Part of that is, the master plan staff is just getting funded. And so as we, hopefully by the end of the month, are I should put this commercial here, advertising for our first chief of policy and research at the Department of Aging, who will have the master plan for aging in their portfolio and builds out a shop. That'll be very important to figure out how we do those appropriately with the right department, right? How we co-lead with Strategic Growth Council, climate change issues, and other key agencies as well. So you're right, that work continues in some direction from this community and maybe on priorities or particularly where there's external capacity. I think we've all found it works best when there's internal state administration capacity and external stakeholder capacity that together can move something forward. So sometimes, and if we have neither, it's really hard to move forward, short of a consultant support, but even then it can be hard. So I think thinking about matching priority and capacity as we make progress quarter by quarter on that. And then Nancy, the local jurisdictions, how to get a handle on it. It's a great question. I think we really have not thought through how we would do that. It's kind of on our next list, if you will, and would love some advice on that. One of the pieces that Janet Spear of Meta Foundation has wisely advised us as part of our problem is just a data and contact management problem. We have so many initiatives with so many partners moving on state level, local level, federal level, philanthropy level, that our spreadsheets are, it's a good problem to have. We're not complaining, but we need to move to a next level so that we can do a better connection and coordination of these 5 jurisdictions are doing intergenerational meals programs. These 5 jurisdictions are doing intergenerational volunteers so that we are doing a better job of making those both tracking progress and connections. And right now it's growing faster than we are. So we're hoping to get some sort of capacity to have a better and hopefully visible, right? Not just for internal, but have a visible public facing view of that data as well. I do want to, if it's okay, move from process, which I'm a big believer in process and partnership, but to policy and just open up some space for all of us to talk about the policy moment we're in. I don't know who wants to kick it off, but I'll just start because I think this is definitely one of our challenges is there's so much to implement, but nobody's complaining. But obviously it's a breakthrough moment in healthcare access for older adults with the asset test dropping for Medicaid, with healthcare available regardless of immigration status down to age 50. It's just a tremendous opportunity and also, challenge for our LTSS system. Are we ready and able to serve more people, more diverse people? How can we do that in every way? The SSI plan to bring back basic income, begin to bring it back to where it hasn't been, and Kevin will correct me, a long, long time, is extraordinary. And then you could go across all of the goals. I know Susan's working on indexing all the Alzheimer's investments. It's quite significant. At our Department of Aging, we'll be briefing people at our quarterly stakeholder meeting tomorrow on about a dozen new and continuing and increased investments ranging from bringing back things like Alzheimer's daycare resource centers to piloting a new housing model, adult family homes, to getting in the workforce space with a direct workforce training and certification in partnership with our stakeholders internally and externally. And some much needed resources for nutrition, family caregiving, digital divide, on and on, elder justice. So I'll stop there because I could spend 3 hours talking about all the budget investments, but love to do a quick round robin of where you see kind of big opportunities that we should keep our eye on the ball that may change things. And then, you know, Andy, we will come back and talk about gaps in a second. I don't want to leave that off given how people keep lifting that, but if we can spend a minute on like, what are you most focused on or think we should be focused on as the real opportunities to move California forward? Fernando. And then
I'll throw one issue in the mix, which I'm getting much more involved with, and that's the issue of homelessness and what appears to be a growing proportion of individuals that are 50 and over, even 70 and over, who are either homeless, cannot afford rent, in danger of eviction, or even chronically mentally ill and homeless. I'm now chair of another organization called Step Up, and we're essentially involved in buying, renovating hotels and motels, and the governor has really been supporting our efforts. And as we move into that space, and we have projects throughout California and the Southeast across the country, we're coming face to face with more and more individuals, a large proportion ethnic minority, of course. So I'm not sure we really bit into that during the master plan on aging process. We had other things that were really crucial and facing us, but I'd just like to throw that into the mix and see if that could be another potential policy initiative that we can put into our agenda.
Kevin.
Well, I echo that, Fernando. I think that's a great place for us to continue to focus. And to Kim's point, I think there's a lot of really wonderful stuff in this budget. There were things that I think we didn't even necessarily ask for in the master planning process because we didn't think that there was the revenue there to support some of these things. So, and then there did turn out to be revenue there. So in some ways we were able to go even further than I think some of the initiatives that were in the master plan with these investments in making healthcare more affordable, with increasing the SSP back up to, you know, over the next couple of years up to the levels where it used to be. You know, a variety of amazing investments. I think from a policy perspective, we're still trying to figure out, Kim, what's actually in this budget. You know, between the budget document and the HCBS spending plan, trying to reconcile what was a budget item, what is in addition in the spending plan. So we could really use some help from, you know, we can continue to dig through these things and try to decipher them ourselves. We could really use some help from your department, from DOF, from the legislative, you know, bodies to help explain to us where things landed, to both then prepare for the table that's been set. Workforce, I think, is another area where it's looking like there's, you know, hundreds of millions of dollars of opportunity to, you know, increase wages and improve training opportunities for the workforce, which is, you know, something that again is really critical. So, but we could use some help really understanding where we are today versus where we thought we might be a month ago or 6 months ago, so that we can do that. And then starting to look forward. And I would say, in addition to like issues of homelessness, you know, issues of equity, I don't think our community was well prepared when the HCBS spending plan opportunity arrived. And I hope, you know, we're working at the federal level to expand those opportunities so that they're not one time, but it's really ongoing investments from the feds to build our HCBS system. And I think we could do more work to think about, if there is revenue for that, what would we spend it on that could truly build this system? And that opportunity hasn't been put forward to us before. It's always been, there's no new revenue. But if the question is, there is new money coming, how do we spend that to build the workforce? How do we spend that to make sure services are in place to meet the growing demand? So I could see that as a, you know, another level of work that we have some luxury now to dream that way and to build for that.
Glenda.
Thank you. When we look at policy, I think it's crucial that as we set policy and look at how policy intersect with one another, that as we're looking at this, we're making sure that one doesn't cancel out another one. Or if we are looking at policy, if I create a policy on one thing, then if I'm working with another government agency or department, will I still be able to receive that service, that desired goal without canceling it out? Because most time, government agency, in the agency don't necessarily talk to one another. So when we're creating a good of something, but unbeknown to us, there are other rules and regulations that cause us not to fully, but what we're creating to be materialized. So I think we have to be aware and conscious as we look at policies.
Nancy.
So I agree with the things that have been proposed so far. I think we have a really unique opportunity in terms of priorities for the population that we represent, working right now with nursing homes to coordinate and through either collaboration or regulation on nursing home reforms, so we don't repeat some of the things that happened during COVID that we don't want to see repeated again. I think we need to prioritize policy for long-term care insurance and what that looks like for the missing middle that's really harmed right now by the cost of long-term care. Housing options, we have a really unique opportunity to be working right now with the legislature in particular on advancing some bills. I think we have a pro tem, a speaker, and some key legislators right now who really want to drive some housing options forward, but they need support to be able to do that. And I was really glad to hear climate mentioned, even though you said, we kind of need to table that right now. But I think in terms of policy, it's important. The way we're going to be tackling it is we're focused on health quality and health equity, particularly when it comes to air, water, energy, and heat. Those are things right now that are really impacting vulnerable populations and some areas that we really need to tackle pretty quickly.
Okay, we've got a big queue. And we also want to make sure we get to some public comment in response to this discussion. So I'd like to hear from Andy and Susan, Doug and Kieran, and then I'll try to do a little quick reflection back and then hear from the public for a few minutes. Andy.
Yeah, I just wanted to pick up on Fernando's point, and I know the governor is focused on homelessness. One of the issues that my housing team brought up with me is that we've got buildings in California that were built to be affordable housing for elders and people with disabilities for a certain number of years. And then once that period is over, it can be converted to other uses. And I think it's worth thinking about in our state, is there a way to keep the housing that we have that's affordable and not have it go in another direction? And is it maybe the state could buy out the rights of the developers or whatever, but just not losing affordable housing that we have, I think needs to be part of the strategy. And then I also just wanted to bring up, I'm reading a lot of articles that lots of people are quitting their jobs, post-pandemic. One of the groups that is quitting their jobs are people that are retiring early. So I think understanding that dynamic in California and trying to help people make good decisions and help people continue to earn and continue to work as they age should be part of the strategy too. And it just kind of understanding that dynamic, I think in California is going to be important.
Susan.
The policy topic I would flag, in addition to what's been mentioned, is system navigation. And we're really happy to see that the Aging and Disability Resource Connections received funding in the budget. But that's probably the most consistent concern that we hear is, where do people get started? What's available to them? People of all income levels, all parts of the state. So to further that, that was a big theme in the LTSS work group about system navigation. And I think I want to make sure we keep talking about that and not adding to it, and really trying to be streamlined so that it's easier for consumers to access that information instead of multiplying the options that are in front of them.
Kieran.
Thanks. Just a couple of additional things I would put on the table in terms of policy issues that I think are timely. One you mentioned at the beginning, Kim, which is behavioral health. I think, you know, we have a really big gap in our healthcare system where behavioral health is concerned, and then we have an even bigger gap in our behavioral health system for both people of color and older adults, and where those two populations intersect. I think there's almost nothing, right, that is really meeting the need. So I think that's going to be an important piece to think about, because I think historically we've thought about behavioral health as really outside of healthcare, but it's not, right? And we're really working on that integration now. So that's one. And then the other thing is, I think just thinking about through all of these, you know, how is this a population health approach, and how is this a multi-sectoral approach, particularly at the local level? And how are we creating the infrastructure that allows not only government agencies, but also community-based organizations to sort of be part of that collaboration. And then finally, I think there's just a few elements to all of the different policy issues that are really foundational from an equity perspective, one of which is data, and just broadly, how do we improve our data collection? Because right now on a lot of our programs, nobody knows if they're working well or not, right? Because we don't collect the kind of demographic and other data that would allow us to do that analysis, or we don't collect it well enough to use it. And I would also lift up language access, which has been a particular struggle around public benefits, and particularly for older adults, that we really need to think of a comprehensive approach throughout the different programs and policy issues.
Kevin, is that a new hand?
Yeah, if I could just sneak in with one other thing that I think builds off of what Kieran was saying and Fernando said too, is in addition to the parts of this new budget that are very specific to older people, there's a lot of money in this budget around homelessness, around behavioral health. And how do we make sure that with that money, that there's programs that are designed specifically to meet the needs of older adults, and within that, communities of color, to the, you know, intersections that Kieran was speaking to. So, you know, really interested in the aging parts of this budget, but also the other parts that are meant for our communities and families broadly, and making sure that there's specific intention there around serving older adults and people with disabilities with those funds. Since we know that's where, you know, lots of times the inequities exist and the need is the greatest.
So I just want to thank you all for, you know, coming right to it. What I heard are a couple things. One, we need some clarity on what all these investments are, and that's that master plan for aging budget document. I know you will start to see DHCS, CDSS, CDA, as we all get our arms around all the different, and bills are actually enacted. But we do commit to have kind of a across the 5 goals. I guarantee you we won't get it all. So you'll have to tell us we missed one, but we're going to try our best. And I know others of you have tried as well. So we will work on that. But I also hear you saying, and I'm thinking about maybe one of the outcomes of this meeting is that we CDA write a memo to our cabinet work group reflecting some of this input kind of as one of the outcomes of this meeting. And so again, Andy's centering us in COVID. And you know, some of the examples around what the nursing home lessons, the examples around the economic implications are still emerging, but that COVID piece. And then I think 2 of our big system challenges, the long-term care missing middle piece. Several of us are on the insurance commissioner's long-term care task force, and what are we going to do around the missing middle piece that the president is lifting up more and more, as are others, and the navigation piece. How do we navigate our system? But Kevin, I do think that one of the pieces you put a nice bow on this. We are struggling a bit with the intersection piece. And the good news is not from lack of interest. We have lots and lots of folks in transportation and climate and behavioral health and homeless who want to work on aging. And we have lots of folks in aging who want us to do more on climate and behavioral health, but finding the folks who have that intersectional expertise and time and capacity to help us chart that is where I think we're developing the sectors in some way. And so housing and homelessness, there's quite a lot of overlap, and that's given, as Fernando said, the rise in that homeless population and the tradition of senior housing. So we have a foundation to start with and kind of stretch to imagine different housing choices, but there's a foundation. But I do think behavioral health, we're talking to folks like Janet Frank, Leandra Clark-Harvey, Sharon Nevins herself, who really are shining a bright light on how much ground has been lost and how we have had to come really reimagine on that. So I think we're struggling a little bit when it's not a classic aging issue where we have lots of folks, but where it's an intersection issue, and how we find the people who are bending towards intersection and how we support them and empower them to lead the way. And then the last point I want to lift up that Karen talked about is this leadership issue and local and work with, I'm not saying it well, Karen, but the role of the local community groups and their expertise and their resources, just to let people know, the Department of Aging has kicked off an initiative called Aging Hubs and Spokes, which is our attempt to look at our network of AAAs and counties and CBOs and ask how are we structured for success in every measure, in outcomes and inclusion and equity. And that's both a governance issue and a resource issue and a roles issue. But we have kicked that off and have a 6-month listening engagement process resulting in some, we hope, recommendations, at least observations, recommendations by December to tee up a modernization of the older Californians Act and potentially more of an investment and accountability framework similar to what you might find in child welfare or CalWorks or other types of services. So we are looking at that, and it's hubs and spokes because we believe if we learned nothing from COVID, it's the critical role of community-based organizations in partnering with government to reach people where they are in the way they want to be reached. We saw that over and over again, vaccines, PPE, and more. And data and language, again, that infrastructure for the system. So those are all really helpful themes. Maybe we can turn that into kind of a report from this group, or at least my version of the report, and share it with the cabinet so people really do hear kind of big themes and I can validate that I got it right before I do it. But I want to make sure that this conversation is memorialized and shared up secretarial level, gubernatorial level, and so on. But before we do that, let's open up the phones and the chat and the Q&A to hear from people about the conversation we've had so far. We'll do that for, I think it's 10 minutes, and then we'll take a break and come back and talk about data, talk about local and next steps. Maria.
Great, thank you so much, Kim. So we are going to open it up to public comment. Again, for folks joining on the phone, to join the queue, you would want to press *9. That will add you in and we can unmute your line. For those who are joining us by webinar, you can use the raise hand icon on your toolbar or the Q&A icon to submit written feedback. I do want to flag that we've got a pretty jam-packed agenda today and we're limited on time. We'd love to hear from all of you, and so we'll be in a thoughtful listening mode, just kind of absorbing all of the comments, all of the feedback that you have and taking that back. So I will pause a second and let's go to our attendees. Mary, looks like you have your hand up. Mary Sheridan. Go ahead, your line's been open.
I'm sorry, I didn't raise my hand on purpose.
Oh, that's all. That's okay, Mary.
Being here and learning what you all are doing. Thank you.
Thank you, Mary. Charlene, your line's been open.
Yes, a lot of good services and a lot of potential are coming up, but not everybody is in agencies or connected to agencies or organizations that are working with seniors disabled. There's a whole lot of people who are just out in the outskirts and have no clue what is going on. So what needs to be done is getting information and resources to everybody and not just the people who already are partway connected.
Thank you, Charlene. Susan, your line's been open. Susan, you may need to unmute and we can always swing back around to give you a little more time. Maybe we can turn to Kathleen Kelly.
Yes, thank you. This has been a wonderful listening session, and I commend the committee and all of the hard work of people across the state that's pulled together for this new reboot of California. I just want to emphasize again this whole issue about the missing middle in this. While we talk a lot about HCBS services, it's really we're talking about those persons that are Medicaid eligible, and the vast majority of individuals that are out there, the families that we work with every day through the California Caregiver Resource Center systems, are a mixed bag of folks that, can access Medi-Cal services, and also, but the vast majority cannot. And so we really need to pay attention to that, because an unequal share of services or access to services that are affordable is not the way that we should be working in this sort of democratic mode. We need to make sure that everyone has equal access. So I just wanted to put that out there. It's great work that everyone is doing, but we need to pull everyone along. All boats need to rise on this, and including the middle income. Thank you.
Thank you very much, Kathleen. I want to swing back around to Susan. It looks like you're unmuted, so jump in when you're ready.
I am. So I'm a member of SCAC in Orange County, and I just wanted to verbalize the importance of getting the information once this wonderful committee has put together its expertise and what it is going to focus on, getting that down to our level so we can make our county government aware of where we're going nationally. Again, another connecting everybody together once again. And so we can be, you will have the expertise of what the most important issues are, what the money, where the money should be going, and you can impart that to us. We can impart it to our county supervisors. So I would just make a plea for that, and thank you for all the hard work. I certainly appreciate it.
Thank you, Susan. If any other folks want to raise their hand and join the queue, please feel free to do that. In the meantime, I do want to read a comment that was submitted through the Q&A feature from Anna. Dr. Torres Gill, Anna agrees with you about addressing homelessness among older adults. She also urges the committee to look at lowering age eligibility for people who have experienced homelessness to qualify for programs such as the Older Americans Act programs. She notes that a 50-year-old formerly homeless individual will have complex and multiple physical, mental health, and supportive services needs compared to a housed 50-year-old that are more similar to someone in their 70s. So thank you for that comment. And Richard, I see you have your hand up.
Hello, Richard Scaff. I'm the Executive Director of Designing Accessible Communities. Two major issues that I keep hearing from seniors, people with disabilities across the state. The first being in-home supportive services and the issue of attendant care and emergency attendant care, and how our state government and state agencies are responding. One of the issues showed up clearly during COVID with the vaccination, when it was almost at the very end that people who were homebound had the possibility of getting vaccines, when at the same time they were having multiple attendants possibly taking care of them. Attendants that would go out in the community and could possibly be carriers. And in many cases, people contacted the state agency that is supposed to be able to provide emergency attendant care with no luck at all. Then we have the issue of folks that are in facilities. One I just heard about a couple of days ago, who wasn't fed for 2 days. It appears that convalescent type facilities, the for-profit organizations, not necessarily the nonprofit, but the for-profit, are still doing a horrible job. And then the last issue that needs to be spoken to, and I heard somebody say earlier about heating, cooling, and energy use, and the outcome of the CPUC, California Public Utilities Commission, giving permission to the 3 for-profit electric utilities they oversee to de-energize their grid with no mitigation measures in place to protect people that depend on consistent electricity for things like heating and cooling, refrigeration if they're a diabetic or have other disabling medical conditions that require refrigerated medicine, and the need to be able to have consistent electricity to operate medical and mobility equipment. It's amazing to me to see people like, and organizations, for example, AARP taking the side of PG&E, saying we shouldn't have residential rooftop solar and residential batteries and create microgrids. So these are the major issues that I'm getting contact from the community saying they're not working, and it's putting people's lives in jeopardy. These are crisis issues. These are not just social issues that we should look at and think about and talk about and maybe get around to fixing. These are today, right now, crisis issues. Thank you.
Thank you, Richard. It looks like we have just one more comment and then we'll take that short break. Comment is from Judy, who wants us to consider not only affordable housing, but accessible housing and housing for seniors. So how do we maintain housing for seniors specifically, or housing people with disabilities specifically, when we talk about increasing affordable housing supply in California? Thank you, Judy, for that. And with that, I'm not seeing any more written comments and I'm not seeing any more hands up. So I will pass it back to you, Kim.
Okay, let's take a 10-minute break. My clock says 2:38, so we'll come back at 2:48. I encourage you to turn off your camera and your mute while you take care, and we'll see you back in 10 minutes. Thank you so much.
Hello? Hello?
Okay, we'll start welcoming people back from break. Thank you very much. Just a reminder where we are in the agenda. We're going to hear from two of our invaluable team members. One, Amanda Lawrence, is going to give a fairly brief update on some of the work that, like as I mentioned earlier, with our local partners that has there's an enormous appetite for. So we'd love to tell you what we're doing and also get some feedback on potential and partnerships, so that we're all in our appropriate, feeding the appetite, but doing so appropriately. And then we did try to carve out some significant time for the longest presentation of the meeting on the data dashboard, which we have built as to really be the accountability tool for the public, for our state leadership, and for all of you. And so Terry Shaw will lead us through a presentation, and if the internet is with us, it'll even be live. So, and if not, we've got a good backup plan, don't worry. But without further ado, we'll have discussion, of course, and public comment, and then we'll wrap up with some next steps that have started to emerge just to validate those. So with that, Amanda, can I hand it to you to talk about all the local playbook and partnership activity?
Yes, good afternoon, everyone. I'd like to share just a few updates with you on how the master plan and communities across California are leveraging the local playbook to drive action locally. So users can navigate the playbook on our website, and it's also available for download. And it features dozens of fantastic resources for communities to refer to when they're developing their own age-friendly plans or their own local master plan for aging. As this slide indicates, there are 7 plays in the playbook, and each of these first 6 plays offers steps, resources, and models to inform and inspire action on the ground. And then that 7th play is Stay Connected. We really want people to share their stories so we can learn from one another. Next slide, please. So it's our intention that this playbook be used by local leaders within government, philanthropy and advocacy, and community-based organizations as a guide to really inform and organize their own planning. As Kim mentioned earlier, it's one of our goals here at MPA that every county have its own local master plan for aging. So this is really one of our true measures of success, is how broadly does the MPA reach across communities across California. And we have over 50 cities in AARP's age-friendly network, and we'd love to see so many more of those. And actually throughout the playbook, we recommend several of AARP's livable communities and age-friendly resources. So really the playbook can be used on its own or as a complement to that AARP age-friendly process, which here in California, we're so excited to have joined as a state. We really want to continue to be supportive of local communities, and we're going to seek over the next several years to strategically build capacity and make connections for folks on the ground who are doing such meaningful work within their own cities, counties, or regions. And of course, we want to work with this committee to leverage your networks. We know everyone here brings local connections. So we'd love to partner with you, as we have with the SCAN Foundation, on bringing local convenings and workshops across California. I'll go through a few of those workshops that we've participated in and share some of the relationships we've been building. Earlier this year, the MPA stakeholders, Shireen McSpadden of San Francisco and Kevin Pernival with Justice and Aging, along with Director McCoy Wade, presented the playbook to the California State Association of Counties, highlighting that important role of local leadership. And that body of Board of Supervisors was so excited about this work and so excited about the playbook that they actually invited Director Kim McCoy Wade back to host a playbook focused webinar for that staff and those groups. We've also been really involved with the SCAN Foundation's local playbook convenings for all 21 of their long-term services regional coalitions. So CDA presented the playbook and the data dashboard, and we're joined by AARP, who shared insights into age-friendly action planning for their large convening of all 21 of their coalitions. And following this meeting, each of those coalitions is hosting its own playbook convening. So we're having these convenings across the state. They've already begun and they're spanning through this summer. CDA, myself, we have attended many of these and presented the local playbook and the master plan for aging initiatives and goals and strategies. And And so it's been really great to hear those conversations. There are local elected officials there, advocates, and tons of local champions who are working on age-friendly and disability-friendly work within their own communities. They've been really well organized. We are really excited to continue to be a part of those. So far, I can name a few that I've been to: Santa Clara, Santa Cruz, San Benito, Nevada County and Kern County, and then the Diversability Action Network, which is comprised of several northern rural counties, also hosted a playbook workshop recently. And then I've also partnered with the California Department of Public Health. They're very interested in this work and applying an age-friendly lens to the local health departments' work on the ground. And so we've hosted a couple different workshops with CDPH where they invited not just CDPH staff, but also local health department staff to learn about the playbook and really have good conversations about how they can use the materials in the playbook and use the master plan to really address aging and equity on the ground. We'll also continue to partner with other organizations. Anyone who is interested, we have plenty of requests for local playbook workshops. So we're going to continue that kind of work. And if anyone wants to reach out and arrange any workshops, please do so. I'm happy to work with you. And then, of course, a really important part of the playbook is Play 2, explore local data. And of course, one of the key components of exploring local data, or a featured resource in our playbook, is our own data dashboard for aging. So Terry Shaw, our consultant to the MPA, is here to share with you and walk you through data dashboard for aging progress, recent enhancements, and how we can use this as a tool to hold ourselves accountable and measure our success. And it, of course, includes lots of local data. So it's been of great use for our locals on the ground and in our workshops. And I'll hand it over to you, Terry.
Thank you, Amanda. And thank you all for your service, and also for having me here today to, for some of you, introduce you to the data dashboard. For many of you, though, you've seen this resource before, but I'm hoping to keep it fresh for you and also demonstrate that, like the MPA, the data dashboard is focused on continuous improvement, because we have some brand new additions to the dashboard that I'll be showing you today. Let's go ahead to the first slide. Next slide. So first of all, I want to make sure that we acknowledge the tremendous contributions and partnership, particularly from the Department of Public Health and from West Health Institute, who really worked tirelessly with us and continue to work with us to this day to put this data dashboard together and keep it as a living, breathing resource. So consistent with Amanda's comments about CDPH being a partner on some of the local issues, they've also been a tremendous partner on the data front. And in fact, the data dashboard for aging lives within the Let's Get Healthy California framework. And again, our partners at West Health have been really powerhouses for us as well. So we appreciate their engagement. Next slide. So the data dashboard for aging was released along with the master plan, and really is intended to be a complement to the master plan that helps everybody who's interested in planning for, implementing, and also, as you all are focused on, monitoring and measuring our progress against the master plan, or towards the master plan. And so the data dashboard is accessible directly through the master plan itself. You can see here, there's a tab at the top of the master plan, and also there's a link at the bottom of the master plan that you can go straight into the data dashboard. Next slide. And as Amanda mentioned, there's also a link to the data dashboard through the local playbook. So trying to draw that connection for folks between the statewide and the local action and the data to drive that action. Next slide. So again, the dashboard is a complement. It's meant to be a complement to the master plan. And so it mirrors that master plan focus on 5 bold goals. Each of those 5 goals has associated data in the data dashboard. We also have an indicator progress dashboard that gives an opportunity to see at the statewide level over time some key indicators to measure our progress towards the master plan goals. So I'm going to show you each of those things as we move forward. Next slide. The key components that I want to make sure everybody's aware of in the dashboard itself is, of course, the landing page, which has all of the cross links back and forth to the master plan itself. And as I mentioned, that homepage for the data dashboard lives within the Let's Get Healthy California framework. Within that landing page, you can access each of the 5 goal pages. Each of those goal pages has data visualizations relating to each strategy. So all of 23 strategies have visualizations associated with them. In some places, we have marked some under construction placeholders because, again, we are continuing to improve this over time. That indicator progress dashboard is another key component that highlights those statewide trends on some key indicators. So it doesn't reflect all the richness of data that's in the dashboard. It focuses on several indicators. And then I think a really valuable resource within the dashboard is the demographic dashboard, which provides a profile of the older adult population in California at both the state and the county level. So I'm going to show you each of these components, hopefully as we are able to get into a live demo. Again, it is important to note that there is a lot of local data that's available in the data dashboard. One key focus there is in the demographic dashboard. Next slide. It is also true that many of the specific indicators have local data available. So I'll show you some of that in just a moment, but this gives you a sense of where some of those local capabilities are. And actually, I need to update this slide because I'm going to show you one today that isn't currently reflected here. So work in progress, as we say. Next slide. So this is a quick view of the progress dashboard, and this is really just the portion that is focused on Goal 5, and actually it's only a portion of that. But what I wanted to be able to show you all is that for each of the strategies, there are key indicators underneath, each one with data points and trends indicated where we have data available for them. You can also see here that we do have some placeholders where we are working to build out the data resources. And in fact, I'm going to show you under strategy B when we get into the demo, we have actually filled in that placeholder related to the California Elder Economic Index. So we'll take a look at that in just a moment. Next slide. All right, so I'm going to go ahead and try to put us into live demo mode. So if you'll give me just a moment to make that transition. Oh, let's see, Maria, thank you. Wonderful. Okay, I'm going to go ahead and make this nice and big for us. All right, great. So we have here the landing page for the data dashboard for aging. Again, it is within that Let's Get Healthy California framework. You can see here on the progress toolbar links to each of the 5 goals as well as the indicator progress dashboard. Again, I'll show you these in just a moment. You can also see here links to the demographics dashboard. You can get back to the master plan itself. You can get to the local playbook, and you can provide us feedback if you'd like. So we really encourage people to let us know how we can improve things over time. So again, each of the 5 goals and the indicator progress dashboard are accessible through this homepage. We also have a series of how-to videos, so you don't have to rely on demos like this. You can actually go in and get a glimpse of the various tips and tools that are available through the dashboard. And then right here on this home page, I'm going to need to refresh this. I can see. Hold on just a moment. Just a moment. Sorry for this, folks. I'm going to keep us out of full screen mode so that it's easier for me to do this over time. I'm going to refresh this page. And we're going to go down to the demographics dashboard. Okay, so you can see here in the demographics dashboard, this is a profile of the older adult age 60 and older population in California. We have 3 tabs, and this structure is consistent throughout the dashboard, where we have kind of a home tab. In this case, it's a snapshot that provides a summary across a variety of demographics for the state. If you select a bundle of years so that we have a bigger data sample to draw from, you can also choose either a region or a specific county. Let's see, I'll do Colusa County. And that allows us to then drill down and create that snapshot into various demographics in a specific county. So it's an easy way for you to quickly access data about the older population in your county. You can see, though, that we are limited in some ways, and I think this is to Kieran's point earlier, that we just don't have the richness of data that allows us to provide all of the demographics in all areas of the county. So that's why bundling across years, looking at regions, these are tools that we've made available to try and enhance the ability to get that rich demographic look. One other thing that I want to note, and actually I'll do this as we move into the detailed tab, which allows you to drill down into more characteristics. We have here, again, you can choose by county, you can choose by age group, broken down by age band, or you can choose to drill down into and select different characteristics. And one thing that I want to note here is that we are in the process of working with colleagues at the UCLA Center for Health Policy, who do the California Health Interview Survey, which is the data source for most of these visualizations, to ensure that we, one, update this data with the most recent that's available, and also to add in demographics related to sexual orientation and gender identity. So we're excited to be able to add more richness of data on those points as well. But this gives you a sense of the types of demographics that you can look at. You can see a quick comparison across states. If you hover over information, you can see more detail about trends. And then the third tab here also allows you to see those same various characteristics, but broken down by age bands to make it easier for you to compare how different age bands are distributed on these characteristics. So a richness of data around demographics hopefully is helpful for being able to assess progress and also engage in planning and implementation across the board. All right, let's go back up here and look at our indicator progress dashboard. As I mentioned, this dashboard allows you to see for each of the goals various indicators. This dashboard does open into its own window, so you can easily get back to the main dashboard at any time. Let's go ahead and expand and take a look at, let's see, goal 5. Let's scroll down to goal 5, and I'll show you that a few things. First of all, we mentioned earlier that one of the budget proposals that's included just enacted is restoration of some of the SSI cuts. And we do have an indicator that is actually about tracking the extent to which the basic supports, SSI, SSP, actually support the cost of living for older adults. So this is combining a look at how well those SSI, SSP payments actually meet the cost of living for older adults as measured by the California Elder Index. And you can see through the progress bar here that we've been trending in the wrong direction. And so we are excited to be able to hopefully show a change in that trend as the state moves forward with its implementation. Similarly, we have let me go back down to goal 5. We have built in a brand new measure on the percent of adults age 65 or older with a household income below the California Elder Index. I'm going to go ahead and take us over to the dashboard itself to dig into that data. But this is really, both of those indicators that I was just showing you are within the goal of affording aging. And I think consistent with, for example, MPA Initiative 129, which calls for bringing older adult basic income, such as SSI and SSP, up to meet that Elder Economic Index standard. So we, again, have tried to build in indicators that match those goals and strategies and initiatives to allow for monitoring of progress. I'm going to go ahead and drill down into, hold on, let me refresh this as well. I'm going to, hopefully, if it shows up, here we go, drill down into a brand new measure that we've just added, a visualization that we've just added under Strategy B, Income Security as We Age, on income security and poverty. And again, this data is built on the California Elder Index data, which of course is a wonderful legacy of that was developed by Steve Wallace and his team at UCLA. That is a measurement of the actual costs of basic necessities, housing, food, healthcare, transportation for older adults in California by community. And so what this visualization allows us to do is show how by county, the percent of older adults age 65 or older who are, and what we want to be able to show here is that we have actually 3 measures of income here to help illustrate that not only do we have large populations of what are traditionally considered poor older adults, in that they are below 100% of poverty, but also the populations of near poor and what are often considered the hidden poor. And those are folks who are below the Elder Index, even though they may be above 200% of the federal poverty level. So this visualization is geared towards helping people understand the older adult population against 2 different measures of poverty. And you can see that we have visualizations here that help you see how things vary around the state. You can also drill into different household types. You can focus in just on, if you wanted to just look at the hidden poor, you could do that. If you hover over a piece of the graphics, you see some more detail. And also, we have a button here to show income security by characteristic. And what that does is allow you to see at the statewide level. Unfortunately, we don't have rich enough data to be able to show it at the local level, but to be able to see a breakdown of these figures by race, ethnicity, and by home ownership status. Because of course, you can see the picture is very different if you're a renter versus a homeowner with a mortgage, or a homeowner who no longer has a mortgage. So these are different ways that we've created an ability to drill down into the data and really understand a more complete picture of older adults around the state. Okay, I'm going to go ahead and stop there in the interest of time and discussion. That was a lot to go through, but I will turn it back over to Amanda to maybe moderate or Maria to moderate some discussion.
And as we open up, I do want to acknowledge, as you did, and as Professor Torres Gill did, the incredible life and legacy of Steve Wallace. As Fernando says, we sadly lost Steve Wallace several months ago, passed away unexpectedly. This index is one of his many legacies, and we are grateful for it and honored to carry his work forward.
Absolutely.
So that was a lot of data for a Wednesday afternoon, but we wanted to make sure everyone had the baseline and can think about what is helpful for these meetings before, during, and after, as we as we measure progress in affording aging, as we measure progress in housing options for all ages and stages. So there goes the queue popping. Wonderful. I see in my queue, Fernando, your hand's up first.
Well, thank you. This is an excellent dashboard, and boy, am I going to take advantage and use it in my classes. But more than that, we talked earlier, and I think Kevin brought out the issue of intersections and intersectionality. And I'm wondering as we move forward, if in time we can start identifying where we're trying to create that nexus. For example, on homelessness and housing, I think we have data perhaps on those two separate ones, but not necessarily how many of those 65 and over are considered homeless, or 65 and over near poor and potentially at risk of losing their rent and or their homes. And so how will we begin to try to track and create those intersections between discrete topics as we move forward? I know it's a lot of work.
Jerry, you want to start? I mean, homeless is a great example, but there's many.
Sure.
Yeah.
Sure. Well, first of all, there is a lot of data that is in the dashboard already, including some pieces that get at some of the issues that you were raising. For example, we have another brand new set of data, rich data, on housing cost burden and what share of older adults spend more than 30% or more than 50% even of their income on housing. So we do have some data that is there, drawing connections between the intersections of housing costs, the total costs of living, which include but are not limited to housing, income supports. All of those dots are in the dashboard, but finding ways to draw them together more over time is something we'd definitely be interested in. And on the homeless point in particular, we have a placeholder on that one right now. And in part, that's because we're still trying to figure out the best data source and the best measures of that. The state has been doing a lot of work on that front. So there's a new homeless services information data set that's available. So we are looking at ways to try and leverage those capabilities as they come about.
Andy.
Yeah, Terry, thanks for that presentation. On one of your slides, you had a drawdown of different demographics, and it looked like it said severe visual or hearing impairment as one of the areas. Are we collecting data about disability more broadly? And if not, why did we drill down in those particular areas only?
That's an excellent question, Andy. Thank you. We actually do have a lot of data in the dashboard. Again, I couldn't show you everything, but there is a whole wealth of data around ADLs and IADLs. And we are actually looking to enhance that data to not just be about the incidence of limitations, but also unmet need. And we'll be doing that again as we're partnering with our colleagues at UCLA to bring in data from the new LTSS module that they did. We'll be looking at ways to adjust the dashboard to focus, and this is actually something we'd love to hear feedback on, but our thinking is that we would focus the indicators on unmet need and maybe draw the ADL and IADL data into the demographics portion of the dashboard, because that's more just descriptive as opposed to an indicator to be tracked. Is one potential way of looking at it. So those are the kinds of things that we will be looking to work with the research community over time. Would love feedback from all of you. Again, we're looking to improve this continually.
Andy, I don't know if you want to make a broader point about sort of disability and data. I know that's been a theme in many of our meetings and discussions.
Yeah, I mean, we don't, at the federal level, we don't have the robust data around disability that helps us track things as well as we can around other demographics. Part of it is the number of questions you have to ask to capture the whole population, but just know that there's an opportunity in the context of this COVID-19 Health Equity Task Force to make recommendations to the feds about the importance of improving data that would support equity. So not just in the disability area, but across the board, if you have suggestions for the feds, I'm happy to surface those.
Excellent, thank you.
Sarita.
Yeah, thank you. By the way, I'm really impressed by this data dashboard. Like similar, I'm going to be playing around with it quite a lot. I did have a couple of questions very briefly. One was, I think, and maybe you touched a little bit on this, but the the HCBS spending plan includes this $2 million investment for developing data transparency, and curious to see how you're going to utilize that that effort and how it's going to align with the master plan, this data dashboard, aging dashboard. If you could speak to that. So I'll start with that question, then I have one other very quick question after that.
Sure. The agreements on HCBS are hot off the presses, so we're all eagerly looking forward to figuring out how to make that all come to fruition. But absolutely, we are tracking the need to align what happens there with the data dashboard. And I use that word align intentionally because our model with the data dashboard all along has been to highlight those pieces of data and those metrics of particular relevance to monitoring the implementation of the MPA, and then direct people to other resources that have more data and more richness in them. And so we don't want to duplicate effort that's going on. We want to be able to leverage effort and frame data that exists in ways that are of particular relevance to this audience. So we will be collaborating closely with that effort, and exactly how that's going to play out, I don't know yet, but we already are in conversations to do just that.
Okay, and yeah, no, thank you. That's great. Appreciate that. And then just another quick question would be, I noticed, are you intending to also include in the dashboard over time benchmark data or targets? I know you have the baseline and then you have the trends, which is a great start. And obviously, as we go forward, love to see if we can have some measurable, some targets as well.
That has been a rich topic of discussion over time and will continue to be. And Kim earlier mentioned this research partnership concept that we are still building on the tremendous input that we had from the research subcommittee during the planning phase. We are looking to continue that partnership, build out that partnership, and one of the charges for that group would be to help advise on exactly those types of issues. I am not qualified to identify appropriate benchmarks, but we have lots of smart people in this state who certainly are, and so we want to be able to draw on that expertise.
And I think it would be also helpful to identify if there were some clear ones that there's clear consensus on from the academics and frankly the political world that is a benchmark that we could start layering in. Others are going to be more contentious about kind of what does that benchmark mean. And so frankly, in this process, we thought we all know we want to go up. We want to do better. So let's start with that agreement. But you're right, as we do go up and make progress, where are we actually aiming may become more important to get some clarity on, spend some time on. Kevin and Susan.
Yeah, I had two comments. The first is just going back to the concept of intersectionality. Where in this data are we able to track progress by, specific race and ethnicity, by SOGI data, by language, and where are you not? And then how can we help advocate to create the systems to collect that data? Kieran and CPEN have been wonderful leaders on this in our states. At Justice and Aging this fall, we're hoping to put together a paper that outlines the gaps in collecting data across California's HCBS systems. I think we have a pretty good sense based on what we know about how our systems operate that there's likely some deeply embedded inequities in who's receiving care and when we see improvements where it's happening. But to the extent that we can leverage this dashboard to help us understand that story, so then we can design policy solutions that are directly impacted, that would be wonderful. So that's one comment, and I guess kind of question, Terry, what are you finding so far, and where we're able to parse data and where we're not, and then how can we be helpful as a community to change that. And then my second comment goes to this question of the targets, right? And I think it's a little bit of a weakness of the master plan that the goals are phrased as like towards the right direction, but they don't really tell us where we're headed or that we'll know when we got there. And I think that, my view would be that's not just a question for the academics. The academics can help us figure out, how we measure it, but I think it's for the community. And I don't know if that's something for the impact committee, for a process question to help say, we need to get more specific here or there, or if that's partly a role for some of the other committees that have been created. So for, the community living committee maybe is the right one to be setting some goal for where we want to be on various measures, or, the equity work group might have some, a lot to contribute about where we're headed on how we, not just how we're measuring equity, but where will we say we've won, or we've gotten where we wanted to be in 5 years, and now the next, benchmark. So I think that's a ripe area for broad, discussion and consensus building.
Okay, mine was quick. This is so impressive, Terry. Thank you. And our state absolutely leads the nation on this. Other states don't come anywhere close to having this kind of data. I'm curious, going back to something Kevin said earlier about telling our story and building the case for the continued need for these programs and services around census data and demographics and when that's expected. And we don't always agree on what, how many older adults and people with disability are in California. And we use some old numbers collectively. So what can we expect there in that demographic piece?
Well, one of the choices that we have made so far, and again, everything is up for feedback and discussion, is that we have focused our demographic data on data that's drawn from the California Health Interview Survey. And we did that as opposed to the census. And we did that intentionally because it has the greatest ability to drill down within California across various demographic factors. That said, it's still limited, and there, particularly when you get to more rural counties or smaller population counties, of course, there's just not statistically valid data that you can show. And so we've done the best that we can to maximize our ability to be able to get as granular as we can, both at the local level and on the various demographic characteristics. But to Kevin's point, and lots of others, there are limitations in the data capabilities. And so we've done our best to try and do what we can with what exists, but improvements in the data itself are definitely warranted.
And do we know, I know there's a lot of criticism of the 2020 census, and we don't, when will those results be known? And do we know?
Oh, I don't know that off the top of my head. I'm sorry.
Just in terms of any trends that might emerge that we can take a look at.
Thank you.
Yeah, sure.
Terry, I was going to ask if you, at the risk of putting you on the spot, if you could share a couple places where SOGI data or race data or has been added in. There's some of those equity intersections that you could provide some updates. I know there are a couple you could highlight, or a gap, either way.
Sure. I would say in general, the SOGI data will be most readily available in the demographic dashboard. When you start getting into specific indicators, you get into very small numbers, and it's hard to really show with any kind of granularity a lot of detail on those demographics. So that's the biggest change of where you will see that particular set of data additions coming. In general, across the board, and I'm sorry, I did a slide showing where local breakdowns are available. I didn't do that for race, ethnicity, language, etc. And that varies on the different indicators depending on the underlying data source and the richness of data that it provides and the quality of data that it provides. So we've always done our best to show it where we can, and most often what we are able to do is show breakdowns of indicator data by county and at the statewide level by characteristic, but not, in most cases, we are not able to do both. And that's the challenge of that's the result of the data limitations that we have.
Nancy Pearson.
Thank you. Terry, the work that goes on behind the scenes to make something like this happen is almost unimaginable. So congratulations on that. To my earlier question about how we're going to know what progress is being made on the regional and local levels that will, roll up to the states advancing this whole notion for the master plan for aging. I do see an opportunity with the 54 jurisdictions, those cities and counties that are already part of the network, because they represent over 22 million of the state's residents. So there are big commitments in each one of the metro areas as well as small jurisdictions. They've each developed a 5-year plan that's been approved. That involves 2 years of data collection and planning, 2 years of implementation, a year of assessment, and their strategies are built around the World Health Organization's 8 domains of livability. So they're the same kinds of things that the master plan is addressing. There might be, it would be a big undertaking, but it would be worth knowing what's happening in those local jurisdictions and how that affects the overall work in the state.
Yes, I agree. And first of all, we do, again, try to point people to resources external to the dashboard itself that exists. And so Livability Index, for example, is one of the resources that we've linked to. But we have grandiose ideas. And one that we've talked about, which I would love to see if we can make happen at some point, is to actually create a way for the dashboard to be we talked about hubs and spokes earlier, to be a hub that could bring together local data and put it together in a single statewide resource. So I don't know exactly how and when we might be able to make that happen, but we are mindful of lots of different options for improvement over the future. And those are the kinds of things, again, that we want to be working with people over time to improve.
Okay, looking at the queue and looking at the clock, any other comments for our local playbook and data leads before I bring us back to some operations discussions on how we're going to move all this forward?
Can I put someone in our group on the spot a little bit? I wonder, Kieran, if you had thoughts on your work on data and equity issues in so many other spaces in California, if you had thoughts about kind of lessons learned from those or integration efforts, that other things that are happening in other parts of the state that we should be plugging into?
Yeah, I mean, it's a good question. And one of kind of a question that I had too is just sort of how this relates to the agency-wide effort around disparities data and gaps in that data. Because I think a couple of things. I think one is that, having adequate data is as much about how we collect it as it is about how we report it, right? And so there's a lot that's, your information about your race can be very personal, and being asked about that can really bring up all the trust issues that folks have. So I think it's a very big issue, right? That's about a lot more than data in some ways. The other thing I was going to say is I think there's an important piece about when we look at equity and disparity specifically, about really looking at like personal experience, like those kinds of measures that I know are in like one place, and I think it's the equity section. But I wonder if there's more we can do sort of throughout to look at, you know, do people feel safe in their housing, and do, you know, those things that really get us to some more of the root causes around disparities that are not only sort of the outcomes, but really the experience piece is a lot of what we look at least in healthcare, when we try to understand disparities. So that's the other piece I was going to offer.
All right, that was, I'm digesting that. That was very thoughtful, Kieran. That had a lot of layers. So what I'm going to try to do is sum up what I think we're thinking about going forward, but it's really to bounce off you, and we'll continue to co-create on this. But let me just take a second to organize my thoughts so I can be coherent. There's a couple buckets of work that I see straight coming out of this. So there's some organizational work in terms of, let's talk about how we want to structure. Well, first, as Nancy said, let's lay our foundation of how we want to work together. We have a draft charter we sent you with the invitation that is posted on the agency meeting, but let's go deeper on that, on how we center constructive disagreement, creative disagreement to push us to success. So we'll take a look at that and come back to you with that. A second is around proposing both a schedule and a template for meetings. Something that started kind of bubbling up for me is, if we were to do a goal focus, we'd want to be sure that we are person-centered, data-driven, equity-focused. So how we would include lived experience, how we'd include a dashboard, how we'd include cabinet, how we'd include the stakeholder committee leadership without turning this into a huge presentation out. So figuring out how we give that 360. There's different sources of expertise and different sources and different perspectives. And so how do we bring that to you in a way that then continues to leverage the fact that we are a small group and we can't all see each other's faces and have this discussion. So we'll do some work on template and frequency and circulate that too, but something in that zone of some time to do a deep dive on our big goals and see how we're doing from a couple perspectives, I think. So let's keep going on that. But then in terms of process, lots of good feedback. How do we communicate these kind of information, you know, the ad hoc housing group or the ad hoc transportation group or the ad hoc behavioral health that are not really kind of ready for primetime public meetings, but we also want to make sure they're inclusive and transparent as we start to. So I want to think about that a little bit more, at least be and work with you all on how do we let people know, hey, we want to convene a small meeting to think about how to move forward on climate. And obviously we continually draw from the well of the master plan alumni, the SAC group, but there are many other folks, and we want to continue to build the pipeline for local leadership and new leadership and intergenerational leadership at those tables. So I think we need to do some more thinking on how that ad hoc work can be inclusive as it grows to less ad hoc. That's the opposite of ad hoc. And I think we have a similar, we're building it in process, the local jurisdiction. Amanda currently is saying yes when Kern County calls or San Benito calls, and that's terrific, but we want to be strategic about how we are supporting networks and then can follow up so that a year from now we see plans or deeper plans or broader plans. So we have some more building the team. I mean, the good news is as you know, we're about to hire and create our master plan policy. So I'm going to be coming back up to you very soon with helping us recruit the leadership for that, because this will be the kind of questions they'll be working with, is how do we develop the policy chops and teams? How do we develop our local support team? And frankly, I think this benchmark question, there's plenty of data questions that were raised around, like, how do we make sure equity is baked in, not just demographically, but as you said, Kieran, experientially, how do we make sure there's also this benchmark, which is a pretty significant, could be a significant piece of work to do that work. And so thinking about how we tackle kind of that 2.0. A little more transactionally, it sounds like the budget document will be super helpful. So we will be working on that to kind of try to map. Again, I'm always happy to have this good problem of, do we capture every single investment in aging, disability, and Alzheimer's, both targeted and intersectionally? There's many, and so we'll work on that this month. And then I do want to capture this meeting into a report out that can go to the governor's office and the cabinet, who are, per the executive order, ultimately charged with success of the master plan for aging. So I want to be sure they heard your input. I think those were the big to-dos that I captured. I do want to acknowledge also that one of the other to-dos on our list is recovering from COVID. And part of recovering from COVID is taking a break. So some of our team will be taking some time off this summer. And if you haven't already, that is your homework as well. So this will be, some of this will be coming back to you maybe more closer to August than this month as the legislature goes on recess and we join them in doing so. So I just want to be transparent about that. That's helping we all build back better for the fall. So comments, suggestions, corrections, additions to kind of where we go from here? Then I'm going to open it up to the public. Oh, no, I'm sorry, two hands, Andy and Susan, excuse me. Andy, please.
Yeah, we haven't explicitly talked about this, but I guess I just want to bring up another audience as we kind of tell this story, which is our congressional delegation and, you know, a friendly administration, including a Secretary of Health and Human Services that comes from California. So I just encourage us to think about what is the story we want to tell in Washington. And obviously they just made investments in the Recovery Act that we're leveraging. So kind of reflecting back to them how we're leveraging those investments and how it fits with the master plan, I think is a worthwhile activity.
Excellent point, thank you. Susan.
Kim, you made me think of something with this, the Secretary's Alzheimer's Advisory Committee meeting, and I don't know how the other ad hoc groups work, but we always produce a memo for the Secretary that's just 2 or 3 bullets. It's not extensive minutes, but there might be a process where each of these groups flags what needs to be heard by this group. And instead of, you know, big reports and lots of minutes, just a very simple and straightforward process would move information forward. And then I really liked what you said, if we do go the goal area route, I envision something almost like a checklist or criteria that we, you know, we'd make sure equity, you know, if we're talking about housing, we remind ourselves, is there an equity piece we're missing? Is there a workforce piece we're missing? Is there a missing middle piece that we're missing? There might be, you know, a half dozen or so things that we want to carry across each goal area to be consistent in how we view each topic.
You're reminding me of the equity tool from our equity work group with the 6 questions to ask. That's a great thought. Other hands or comments? I captured both of those pieces, kind of adding that, so not just the template to the presentation, but a template to the review as a prompt. And then again, thinking through this notion of, are there a handful of key aging, disability, and Alzheimer's committees where that kind of, I'd love to see you that example, Susan, of like that kind of top line, couple things that should go to the Secretary of the Cabinet and to impact maybe of, here's what you need to know from community living or Alzheimer's or elder justice or equity or housing as those tables get set, or workforce. That could be a way that we can stay connected without getting buried in meetings and minutes. Okay. Thank you, Nancy. You're right ahead of me, and we're going to turn it over to public comment number 2.
Great. This has been a pretty riveting discussion. Thank you so much. So we're going to turn to public comment. As a reminder, again, just in listening mode, hearing from all of you, taking in your feedback, digesting it. If you're joining us by phone, *9 will put you into the queue and we can unmute your line. And if you're joining by your computer, you can use the raise hand icon on your toolbar, or you can use the Q&A to type in your comments. Additional public feedback can be sent to engage@aging.ca.gov. So let me take a look and see if we've got anybody in our attendee list. Seeing none, I do want to read a comment that came in through the Q&A. I think this is more of a question, Kathleen, so I'll read it. I don't know if we can get to it. Kathleen Kelly is asking, will service data also be included in the data dashboard? In other words, who's using what services for how long to what benefit? Since there will be an increase in services available, where will this information be tracked and made visible? Thank you for that, Kathleen.
And I will, Terry, if you want to try to answer that either in the Q&A, that would be, if you have that answer at your fingertips, that would be great.
We are going to be adding information from the LTSS module of CHIS, which I know Kathleen is familiar with, and also to the point that was raised earlier, as the data transparency component of HCBS gets enacted, we will be aligning with that. And so that utilization data related to long-term services and supports will show up one place and or the other. But we do have some data on utilization in the dashboard already.
Fantastic. And I'm not seeing any raised hands or additional comments in the Q&A. So Kim, I defer to you about how you would like to proceed.
Let's give it one more minute. I will say I'm happy to open it back to the impact too. I mean, this is exactly what we were hoping for, is thought partners who could really help us think together how to build this plane as we're flying it, and adding more planes to the fleet. But I also just want to, if we do have time before some public comments came in, if there is something that you have been carrying around, we haven't done this yet, or this is a gap, or this is off mark, here's a minute to make sure it gets said. We've heard a lot of things that need more attention or more or attention next, but anything else from the impact committee while we're waiting to see if the public has anything else to add?
This is Kevin. This is a little in the weeds, but it builds off of the comment Terry was just making about the LTSS data transparency item in the HCBS spending plan. And, you know, we just saw yesterday the new version of the plan. Was that yesterday, I think? Losing track of things. But, you know, the original version of that plan called for $20 million for LTSS data transparency. The final version of the plan called for $2 million. Is that going to not be enough? And I guess that's a question on several other items in that plan that were either eliminated between the original version and the final version, or significantly reduced. So I guess the question is, on the data piece, is $2 million enough to make the kind of investments we want to see, especially around equity? Or did we need 20 million? And why did this final plan have a reduction? And then broadly, I don't know, Kim, if you can speak to broadly the reduction to a number of items in that plan in just a 1 month period. You know, a month ago, it was 20 million. A month later, it's 2. And there's
Sure.
there's a litany of items in that category.
Sure. I could speak broadly and specifically, briefly. 3 adverbs there for you. So broadly, as you probably saw in the budget enacting language, is that the Home and Community-Based Service Plan ended up as a partnership between the legislature and the administration. So the $3 billion that California is scored to spend on home and community-based services, in a month ago, the administration laid out a plan for the full $3 billion. And meeting with the legislature, again, in a partnership, it ended up with $1.5 billion coming from the legislative priorities that had been passed in the budget, and then $1.5 billion from that administration's initial $3 billion. So absolutely, there were painful and difficult and challenging choices to make in getting $3 billion to 1.5 on the administration side. And I just, want to commend Department of Healthcare Services and all the departments who worked together to try to make those tough choices. In our department, the Alzheimer's Daycare Resource Center was originally at 10, I believe, and now is at 5. And so, I think plenty of people would talk about the need being bigger than both of those numbers, but we certainly will make strategic and we hope life-changing use of that $5 million. On the specific proposal on the LTSS data transparency, I think that's exactly the question is, I'm optimistic actually, because there's a lot of pieces already in play on that one. We do have data at OSHPD, data at CDPH, data at our Ombuds program. And we also have a really terrific leader in California in Cal Hospital Compare, who is already moving to add Cal Nursing Home Compare data and is interested in exploring Cal Home and Community-Based Services Compare. It's probably not the catchy name they'll come up with. But so I think that's a partnership opportunity that with their nonprofit and philanthropic leadership, some state leadership, some potential federal one-time money, there will be a way to move that forward. I think that's going to take some strategic planning, and I believe that item is with DHCS to plan and convene us cross-department to think about that, and we're certainly thinking about it in our Ombuds hat as well as our master plan hat. So I won't answer the question of is 2 million enough, but I will answer the question that I think 2 million can help us leap forward. We just have to be really, as always, smart about where you spent that first 2 million to really move us forward to something that is actionable and user-friendly for the variety of users who need that data.
Looks like Nancy has a comment as well.
Yes, appreciating Kim inviting questions for us that haven't been answered. But one thing, I understand the strategic overlay of the executive order, the master plan for aging being rolled out by the governor, but I'm much more interested in the tactical approach to operationalizing something like this. So FIG talked about cabinet level meetings. That's one place that's part of a structure. But what's the specific mandate to agency heads that there will be coordination on the work that's being done to reduce duplication of effort, to ensure that results are being achieved? How does that happen? Because when we're involving both mid-managers and senior leaders in moving things forward, what's the reach to ensure that that does take place?
I would say it's a great question. I'm going to answer this in 3 parts, which may not add up to a whole, but I would say the cabinet work group is absolutely still empowered and driving that. And so in terms of convening and meeting, they don't consider their work done with the master plan, they consider it beginning. I would say secondarily, every initiative in the 21-22 plan there was with the agency name next to it. They signed off on it. They agreed to it. They offered it. So I think they're holding themselves accountable for doing what they said they would do. And then I think the third piece is the governor's office position that is proposed and funded to be added. And that role of working directly with the cabinet team that Fig mentioned will also help add that kind of connective tissue and momentum to the cabinet work. But it's a great question, Nancy, and your experience with other states and seeing where things can, inadvertently with the competing priorities and other and turnover, where we can lose momentum. I think if you have structural and process advice to how we make this, go the full distance through 2030, we should be thinking about that and how we can make that happen. It's a great question.
Thank you, Kim. I think it will be really helpful to understand what authority the new position has. Yes, they will be on the cabinet, but will they be empowered with the right kind of authority to bring people together and make things happen?
Got it. Okay, Maria, are we seeing any other comments or questions come in from either Impact or the public?
We are not.
Well, I'm happy to give people another 10-minute break before your 4 o'clock meeting. We are really trying to invest in health and wellness here as we go forward. And I think we do have a robust list of things to think about and to do. This is terrific. And this is just one of many conversations, but it's great to have this enormous firepower assembled here to power the work and to inspire us and to challenge us, and look forward to many conversations with you ongoing. And you'll hear from us in coming weeks, not days, but in weeks, as we follow up and move us to the next half of the year. Thank you all.
Thank you.
Thank you, Kim. Thanks, everyone.